You can hear me. For your convenience and better understanding, we will take it without skin. Okay, you will understand the anatomy better. Once you know this thing, you can just take an ellipse of skin along with the same thing. That's all. Blade marking. So we just mark the pubic tubercle, okay, and this anterior superior iliac spine. You palpate the iliac crest, whole of the crest, and you can just give incision above that. So we just palpate the iliac crest and give an incision above that and come up till here, above the inguinal ligament. So you cut this thing, expose the external oblique. The first thing you see is external oblique aponeurosis. Then you split the external oblique in the line of direction of its fibers. Yeah, that's okay. And after doing this, you just come across the internal oblique. And you just dissect over the internal oblique. This internal oblique could be used for monitoring this thing. So you come till the lateral border of the rectus, you can come. You can take a big chunk of muscle. Okay, then you mark this internal oblique, whatever you want to take. Okay, you mark the length of the iliac crest, whatever you want to take. So suppose we are taking this much length. You mark the internal oblique that you have to take. Then you give incision along the line of directions in the upper part and keep seeing the change of direction of fibers. The moment you reach a proper plane, you will encounter various nerves traversing this space, so you can protect these nerves and just go above it. It's the difficult part of this dissection, so you have to be patient. The tractor is not there. Eh? You can now see below is the transversus. Again the direction of, you can see the nerves in between. I think I am in a plane. If we are Just yeah. L20? No. So below is the transversus. There is a clear plane in between here. So you can go here and then keep dissecting and cut the internal oblique. There is a light, light is there. Here. No. This is what is this? Are we below the plane? That is the plane. I think. Sorry, I think I've missed the plane in this cadaver. I've taken the transversus part also. We'll just try to go in because if you miss the plane, when you incise these vertical fibers of internal oblique, you have to be very careful to see that as soon as you reach a very thin space in between the neurovascular structures are going, you have to stop there because the transversus is very thin. You can very easily go through it. So I think I have missed it here. Yeah, this is the correct plane. And now you can see the vessels here. Yeah. You see, just once again, this is the line of direction of internal oblique and this is the line of direction of transversus. So it is crossing at 90 degrees. And here you can see a small, if you can appreciate, this small vessel is running. This I want to delineate for you. This is the ascending branch. This is the branch. I think you may not be able to see that well in that. Once you see this, you just have to trace it. Okay. After seeing this, you cut the internal oblique anteriorly. And then you will have to split it here to create a space for your dissection, and keep following this vessel. Here it goes below and meets with the DCIA vessel. Take a bigger gauze. Are you able to appreciate this vessel here? Okay. Now by this time we have already reached the external iliac artery. So it's around 5 centimeter of length. So this is the vessel. This is the DCIA vessel. And here we can see the femoral external iliac vein and artery. So this is the whole length. So once you have identified it and traced it to the source vessel, then it is easy. You can okay, then this transversus here, which we took by mistake here, this transversus is then cut like this. You cut this thing and then reach the extraperitoneal fat and you retract it like this. You retract it, and this is the iliacus muscle which you are seeing, and on the iliacus is running this lateral femoral cutaneous nerve of thigh here that we will see. This is a nerve, one nerve. The 2-3 nerves are running. Okay, then what you do, probably this one. One is the iliohypogastric, another is this. This is the lateral femoral cutaneous nerve of thigh. This you have to trace here and save it while doing the anterior dissection. So you can loop it. Sometimes it passes above the vessel, below. You may have to sacrifice it if it is passing between the branches. Now you come to the lateral dissection. And here you straight away go to the iliac crest. With the electrocautery and keep cutting it. In the posterior aspect you cut the gluteus. This camera, this camera may not show you this outer side. We are cutting the tensor fascial ada anteriorly and behind gluteus. Here you have to be careful not to cut this nerve. So we partly cut it. And then by pulling this nerve, we can see, no, it's not focused. We pull this nerve and here you can appreciate the movement here. So this movement, we can then trace it and protect. Here is the pedicle. Yeah. Okay. Scissor. Okay, now you can see that, can you retract? Under vision, we have protected this nerve which is passing here, and luckily it is just passing above the vessels, so it is easy to save the vessels now and save the nerve also. So this nerve is freed. Once you free this nerve and you know that this is the pedicle, you just go below. You go below the pedicle, free it, ligate all the branches, and then all you have to do is to cut this muscle. You cut this muscle, cut the iliacus, take the bone. The flap is in your hands. That's all. The important thing is just trace the ascending branch of this DCIA, it will take you there. That's it. And identify this lateral femoral cutaneous nerve because it will lead to anesthesia of the whole of the lateral thigh. I would say it's not needed to cut the bone here. It will be a waste of time and it will hurt you also. You just do this dissection, then you can just do it. Then the final dissection is, this nerve is protected. Okay, you loop this, just put this thing. This nerve is protected and this vessel is protected. Sorry, light. This vessel is protected. Just hold it. You apply this. Yeah. Once these two things, lift it. Once these two things are safe, then you just cut this. Just cut it, reach the iliac crest. And then based on the length, you give a cut here. You give a cut here. You go to the required depth and then just take your saw anteriorly and then keep cutting, keep cutting, keep cutting. The flap is raised. So it's a very easy to raise flap, there is no problem. Only thing, you have to close the abdomen very properly to avoid herniation. And second thing, that the pedicle length is not very long, but the quality is brilliant. It's very good. So if you need it for some bone reconstruction in the upper limb or anywhere, you can use it if the pedicle length is not a consideration. Especially good for mandibles. Okay.